Good afternoon, everyone. Welcome to the first webinar initiative of the Bionest project, which MSMF, Villgro, NH Health City, all the three organizations have come together, which is supported by BIRAC, and we've started this together. Today, while we do this first webinar, we'll be talking about innovation in health tech in India. And we've got along with us an esteemed panel who will be speaking on this topic. But before that, I would like to invite upon Dr. Paul Salins to share the vision for the Bionest project along with all of us. Dr. Paul Salins, over to you.
Thank you very much. Indeed, I hope you all can hear me. Thank you very much for organizing this webinar. We are going through an unprecedented time of challenge, but it is also, I believe, a time of great opportunity when we have to rethink the whole understanding we have had in health tech. Because till now, health tech had a role as providing equipment, machinery, things which actually assist the doctor. Now I think we are getting to a situation, unless the engineering fraternity itself takes a participatory role in healthcare, providing a means by which people can actually remain away from hospitals, away from resources, but are able to participate in the most of the key activities of healthcare. And doctors are able to reach out, of course, with the exception of things like, I think obstetrics, you have to actually come to the hospital. So Dr. Kiran is very much a necessary person in this. But on the whole, even the entire care, if it can be actually translated and care provided within a community and home setup, I think this requires a lot of independent thinking, which earlier was not necessary. But now it will become increasingly necessary as we enter a new era of healthcare, which will be a healthcare which will be motivated, directed, and in very unique ways translated by engineering sciences or technology. That is why I think what we are doing, and Narayana Health is a fantastic ecosystem for startups, because this is a place where you see every sort of problem in its natural context, from the most specialized and advanced to the most basic. And also you come across probably one of the most vibrant team of people who innovate every day at their medical practice. And I think it's very important that we come together and create an ecosystem where you are within a hospital system or within a system where you have a constant possibility of interaction and getting responses. That's why we created it at Mazumdar Shaw Center for Innovation, and with Villgro and BIRAC is a unique setup where we hope to bring different sort of engineers and give our doctors and our healthcare professionals the opportunities to communicate with the technology developers, entrepreneurs, the sort of ecosystem in which they can actually experience firsthand the challenges that are there and the iterations that can be provided. And also see before their eyes how their technology begins to make a difference in healthcare over the years. So thank you very much indeed for making this happen. And I wish you all a wonderful interactive time. And I do believe at the end of this, we'll be making considerable progress. Thank you very much indeed.
Thank you, Dr. Paul, for sharing this lovely introduction. Aryaman, I'll request you to go to the next slide, please. I'll just cover a brief introduction about this initiative. We're coming up with a physical incubation space at Bangalore, and interestingly, ours will be the first corporate hospital-based incubator in India. We are focused on MedTech, HealthTech, BioTech, early stage startups. And in terms of the benefits that our incubators will receive would be, next slide, please, Aryaman. Right from mentoring, access to funding, physical incubation space. But apart from that, some of the unique features, which is in terms of technical advisory, clinical idea storming and validation, access to the hospital network where you'll be based out of and working. And obviously, more such interesting things, access to our network as well. And that is where today, with some of our network members, we'll be doing this interesting conversation, bringing different perspective on the innovations in health tech in India. So without any further ado, I'd like to introduce our speakers first for today, followed by the new unique system of webinar that we've launched for all of you. We have with us Dr. Ramesh Byrapaneni. He's a cardiologist by profession with his keen interest in premier clinical research investigator and a business enthusiast. His formidable background in medicine and his passion for innovation, he has played a major role in disrupting the healthcare sector in India through his leadership at India Partners. He'll be bringing the investors' perspective in this conversation. Along with Dr. Ramesh, we have Dr. Lavanya Kiran. She is a gynecologist by profession who's been driving innovation in modern medical development through her innovative thinking. A vivid experience in consultancy for OBG and robotic surgery at NHL City makes her an expert clinician in the healthcare sector in India. Along with Dr. Ramesh and Dr. Lavanya, we've got Professor Ravi Bhallamudi. Professor Ravi, by profession, leads the Incubator for Entrepreneurship at IIT Bombay. With his years of expertise in manufacturing, he has been mentoring various projects. He's also written a book called as The Essence of Medical Device Innovation, which makes him an expert in the growth industry of health tech in India. And we are sharing the dais along with them. We have an entrepreneur who will share his perspective, Kalyan Salium. I'm sorry if I'm pronouncing the second name inappropriately. Please excuse me for that. He is the co-founder of Healthizen Initiative and 5C Network, both the ventures dedicated to enhancing the experience of public healthcare in India. His modern approach to solving the problems for public healthcare services makes him a substantial person to build the future of healthcare in India. Moving further ahead in terms of our in terms of how we've structured this webinar, we've created a new format. Aryaman, can you please move to the next slide? Please move to the next one. What we've done is we've structured this webinar into 4 interesting segments. We've got the segment 1, where each of these speakers will share the insights, each one of them for 90 seconds. Each speaker will share a thing that they believe is an interesting observation they find in the health tech ecosystem in India. From there, we will move to the segment 2, where they will share the stories behind these insights, and each one of them will share their views for 3 minutes on each of them, followed by the third segment, which is the ideas that emerge out of those insights, as well as out of those stories, and the fourth segment, where the rest of the panel members acknowledge the insights and the ideas that are shared by the other 3 panel members. So without wasting the time ahead, we move to the first segment of our panel discussion today, of our webinar today. So Aryaman, please click the next slide. Next one. Great. Next, please. And here is where Dr. Ramesh, I hand it over to you.
Yeah, thanks, Villgro, the team for putting up this seminar, webinar, and obviously the the format looks very interesting. Obviously, 90 seconds I have, but I thought two interesting things I want to talk about it. COVID brought the innovation biology into focus in India, and hope to see the puzzle cracked soon. And my second thought process is COVID brought telehealth into focus globally. Even though the title of the webinar is technology, I just want to make sure, to me, technology is not just engineering, to me also is biology related. And maybe in the next part, when I get 3 minutes extra, I would like to speak why I brought these two topics out. People ask me, even though I said COVID brought the innovation into focus now, our thesis in 2015 is still the same as 2020. The only thing is COVID brought all our thoughts out and others are accepting it. Maybe I will reserve my comments to the next part.
Great. That was much quicker than 90 seconds. We move to our second panel member. Next, please, Ariman. And Professor Ravi, we would like you to share your views.
Very good evening to all of you. It's really a privilege to be in this panel. And I was just thinking that the panelists have between them not just one, but multiple specialization. It's medicine, technology, and investment, and entrepreneurship. And if I may be representing as a mentor or an innovator or researcher, I think this is a beautiful combination. And of course, Villgro bringing not only these specializations together, but also in their own ecosystem. The 2 points which I want to add is that one is that is absolutely right. This pandemic has thrown healthcare into the center of the focus of our universe, you can say. But it's not easy to actually put all the stakeholders together to actually create the products and take them through what I call as valleys of death, ideation to invention to innovation to impaction. Because innovation is not possible unless people can collaborate. Collaboration is not possible unless you create a very conducive ecosystem for doing that. So the example which I'll share a little later will be about, or the story, more like a story. It will be about how something like that is possible and how to do that behind the scenes, creating the environment. But I look forward to also the deliberations and questions from the audience as well. I look forward to a very enriching evening for all of us. Thank you very much.
Great. Thank you so much. So we've heard an investor's perspective. We've heard the perspective from someone who runs an innovation program in HealthTech. From there, we move on to taking a clinician's perspective. And Dr. Lavanya Kiran, over to you.
At the offset, I think I would like to thank Villgro, especially Rohit and Dr. Paul for this wonderful initiative. I would like to say health is not a mere absence of disease. Remember, with sick people, we can only build sick nation. Let's establish a culture of health. We need to build healthy nation. If we need to do that, we need to focus on long-term health goals. So with this note, I would talk about two ends of a spectrum where I'll be focusing on our today's generation, the children, the younger population. And this is how we have realized that the pandemic has changed our perspective of thinking. Let's think of healthy and safe India. On the other end of the spectrum, we have much high-risk people, geriatric age group. There are people who really need the healthcare sector, like Dr. Paul mentioned that obstetricians cannot remain at home. They need to come, but they are at high risk. Geriatric group are at high risk. They do not want to visit a hospital. How are we going to use our technology in getting these people safely to the healthcare workers and make sure their health is taken care? So innovation should join dots between the care providers and end users. Healthy India isn't a dream anymore if we can do this together. I'll reserve my stories for the next session.
None of our speakers are allowing us to play the beautiful buzzer that we have.
Rohit, that comes with your warning.
And moving on to an entrepreneur's perspective, Kalyan, over to you.
Good evening, everyone. I'm Kalyan Shivasailam. I run a company called 5C Network. We are India's largest radiology group. I come with two perspectives. One is that tele-diagnosis and not tele-consultation is the future of telehealth. For all those of you who are feeling slightly under the weather today, even though we have some incredible doctors in Dr. Lavanya and Dr. Ramesh on the panel, just seeing their face is not going to make you feel better. Telediagnosis and not just teleconsultations is going to be the future of healthcare. The second perspective I want to bring is that the massive impact of digital healthcare and digital innovation will first be seen in tier 2 and tier 3 India rather than tier 1, because the incentive structures are fresh and because the cost structures will not be, will allow innovation to flourish rather than hinder it with red tape. I'm excited to share my perspective with all of you and really excited to be a part of an incredible panel. I'm a fan of all the other 3 people on this panel and looking to learn a lot. Thank you.
Super. So none of our panel members, for all our attendees, gave us a chance to press the buzzer. All of them have been well speaking in the slots provided to them. Arjun, can we please move ahead? And from our section 1, all these insights that the panel members shared with us, what are the stories behind those insights? How do they, what actually made them, share these insights, and what are the points connected to them is what each of our panel members would share. And in the same order, we hand it over to you, Dr. Ramesh.
Yeah, the first one I mentioned is the biology. All these years, I'm assuming that a lot of entrepreneurs are there in this in today's audience. And all these years, the common comment we hear is India is very strong in chemistry, but very poor in biology. And I think this COVID brought attention to 2 important things. For example, a couple of Indian companies are doing the vaccine, BioTech and one more from Ahmedabad, Covaxin, I forgot the name of the Cadila. So we're not very behind. If you see the leader, forget about the China vaccine and the Russian vaccine, the AstraZeneca, Oxford, which tied up with Serum Institute of India, they had to withdraw their vaccine yesterday. So what I mean, even assuming it's not withdrawn, probably Indian vaccine manufacturers, the innovators, not the Serum Institute of India, we're not behind it. 6 months, probably at the maximum 3 to 6 months behind. That means we have the entire ingredients to do innovation in biology also. And I would take vaccine as an example because you're able to use live organisms to produce proteins. The same thing can happen tomorrow in monoclonal antibodies. So that's the reason I said COVID brought the biology focus, and I see a strong future for biology-based startups in this country. And the second thing, even RT-PCR, for example, we're not that late. The antigen has been detected in March, February, when the first genomic sequence has been published. While China and Taiwan has access little more, we're able to produce a RT-PCR test, commercialization. We're able to export them within 3 months after the start of the pandemic. So not only in the vaccine, ability to bring out a new innovative diagnostic test, very high-end test in 3 months, commercialization from proof of concept, that not only shows we have the capacity, our regulatory authorities also are up to speed. So they are able to come up to speed, they're able to remove all the bureaucratic hurdles. That's the first story why I said COVID brought biology into focus and a great future for Indian startups. The second one again is related to the telehealth, telemedicine, teleconsultations. Probably I would say, probably India will lead the way for telehealth to the entire world. And you'll be surprised by March 25th, if I'm not mistaken, even maybe a week or 2 weeks after the WHO announced the pandemic, Niti Aayog, MCI, had come out with their guidelines on teleconsultation, which is pending for the last 30 years. Until 3 months back, we're not sure whether it is legal to give a teleconsultation, legal to give prescription. All this is behind the past. But why I said India will lead the entire world in telehealth. Prime Minister announced on August 15th that every patient will have a healthcare ID. I think that will be the most innovative. I strongly anticipate in the next 24 months at least, every doctor, every nurse, every healthcare, every hospital diagnosis center will have an ID of their own. And every interaction between a patient and a hospital, a diagnostic center, or a farm will be captured digitally and will show the way to the entire world. Thank you.
Great. I'm excited that our buzzer actually went out in at least in one situation. Great. So that says you're.
There's no cheating, I suppose.
Great. So moving from Dr. Ramesh, you to Dr. Ravi, what are the stories behind the insights that you shared with us?
We are giving only 3 minutes to share how many stories. So let me tell you quickly, and I'll connect with whatever I said earlier about the need for collaboration in ecosystem. And also the points came up from other panelists, that is about health, connecting the dots, clinicians' role in the whole thing, and of course, telemedicine and preventive health and so on. So let me just, this story is about, you can say 3 people. There's one clinician from a rural health hospital from Durban, which is a midpoint of Bombay and Goa. There's an electronics engineer from Dehradun who was at that point working in a semiconductor company in Hyderabad. The third guy is a software engineer in L&T Bombay. And they met for the first time in a hackathon which we had conducted at IIT Bombay, and for the first time. And the doctor says that when a patient comes to me in a rural hospital and I put a stethoscope and I never heard the sound before, and I have a problem. Do I send this patient to now a city for a second opinion? Can I not send the sound instead of sending the patient? That is how the problem was born. But after the hackathon, after building a proof of concept, these people went back to their jobs. But after 6 months, they say in India, Kida lag gaya hai. So they gave me a call. They said, can we come back to IIT in some way? These are not IIT students, please remember that. And can we do a work on a project? So we created a project, gave them project staff position, some kind of fellowship, you can say. And within 1 year, they went from POC, which is proof of concept, to a prototype. And 1 more year later, they went into an actual product. And product means a batch of 5 or 10 products, which you can actually distribute to different clinicians, ask them to try it out. And in the whole process, they applied for a patent. They applied for the BIG grant. And I think Villgro is one of those Bionest where they mentor entrepreneurs for this BIG and other awards. It's one of the most beautiful awards because 50 lakh rupee check comes directly to the entrepreneur. So these guys got the award. They started a company called IU Devices, which is in the business incubator of IIT Bombay. Within 1 more year, they had already gotten orders from Maharashtra government, Gujarat government, for several PHCs. And in the last 1 year, they now have, they're almost like 1,600 devices sold, most of them for either PHCs or telemedicine companies. So I'm very happy that we're talking about that. The last thing that happened in the COVID situation, and I'm answering one more question in the chat box, is that they found that many senior doctors who can actually judge these COVID chest auscultation sounds, they themselves were senior and diabetic and they could not be exposed. So they were sitting in their houses. So what the hospital would do is that they would put the stethoscope on the patient's chest and it would be either transmitted live or it can even be stored and then, WhatsApp to the doctor and they could do the expert opinion on that. So these guys could actually move from their basic unmet need to idea to invention to innovation, commercialization and impaction. There are now hundreds of patients who have been to village, rural medical camps and so on. They have been, they could catch things like cardiac issues, your breathing issues, COPD. I think they are creating a real impact. And they have been all over in Forbes magazine, Business Outlook and things like that. And that is inspiring many more now innovators. So this is just one of, let's say, 20 stories. We have now developed like 200 devices, filed 55 patents, 20 have been licensed, 15 startups, 5 to industry. So we have been able to create the so-called ecosystem. But more about it, I'll tell in the next segment about what is the behind the scenes, what are the elements of success stories and so on. But thank you very much.
Just in time. So moving from Dr. Ravi, bringing in the incubator's perspective to Dr. Lavanya Kiran, who will bring us the clinician's perspective and share the stories.
So uncertain time calls for innovative solutions, and at present time we all have agreed that This has given us unimaginable opportunities to think of out of the box ideas. So one day when I woke up and I had already this invite, and then I was thinking, what do we do? What solutions can we think about? Because today we have COVID. And then I wake up to see in the paper that we have contributed almost 25% to the COVID mortality and morbidity of the world. Then I was thinking, why are we always thinking about solutions? Why are we not thinking about curative things? Why are we not looking at long-term solutions? Because you can see whoever has come to COVID-19, it is most of them who have had less immunity, people who have had comorbidities, they have diabetes, hypertension, obesity, one of the biggest morbidity, I would say. These are the people who are coming. So I was wondering, why are we always looking at technology in a different perspective and thinking about solutions? Why are we not thinking about hitting the source and going to the ground reality? Because today it is COVID, tomorrow it can be something else. 10 years down the lane, we may have another virus, we may have something else coming up our way. If we have set a healthy nation, healthy people, we will sail through any kind of diseases that is going to come, and even then we are going to say this too shall pass. So let's come to a ground reality from our sophisticated towers where we're sitting in our AC setups, and we are forgetting the ground reality from where we started. We didn't have all these things when we look behind so many decades back. That is because people were doing so many exercises. I was thinking about my PT classes where on a Saturday morning we would sit in the sun, do all the exercise. These days kids are only at home, gadgets, no sun exposure. And today at COVID, we are talking, take vitamin D. If you had done this, we don't need to learn from the West talking about pranayama, breathing exercise, yoga, all these things. West is already spoiled us. We've come into a lot of bad lifestyle that we have already implemented and then inculcated, and this is why our morbidities have increased. So I was wondering, why should we not touch on our traditional methods? We are talking about taking vitamin C in order to keep yourself safe from the COVID-19. Why are we not promoting our own food? We are talking about carbon dating. Why are we not talking about amla, which is on our kitchen garden? So let's talk about our own resources that we have, and of course see to it that the AI is used wonderfully well to make sure every citizen follows this. Once every citizen starts following it and this becomes a mandatory. We were talking about, Dr. Ramesh sir was telling that there is an instrument, there's an app, the government's going to come up with single unique IDs, the health schemes. Every person has a mobile phone user now in this country. So why don't you link your exercise, and that every day he has to mention, and that is when he or she gets a discount on the monthly mobile bills, or they're going to get the ration free. Make sure your AI traces how much they have done. So you do a 10 sit-ups and then they get a ticket free to travel to whichever place they want to be reaching. So your ration's free in the rural setups. If we start doing this, I think we will be addressing most of the issues. Now we know Ayush is a wonderful initiative from the government. Of course, all the doctors look happy, but then are we really happy? Because we're thinking them as a competitors. Let's not think of them as a competitor. Let's think about allopathy, Ayurveda, Unani, homeopathy to complement each other. Why are we trying to make them compete with each other? And if we make sure that these people use their own talent, use their own specialities to treat and help people, bring in their own specialities. Allopathy people can treat the real needy, real emergencies. That is how the high-risk people can be targeted. That is how risk population can be addressed well. The geriatric group, the people who really need the healthcare sectors can be concentrated on. We were talking about wonderful stethoscopes which can pick up the ECG, can transmit. But who's the person now putting the steth on that patient? You're talking about social distancing. You don't want to be near that patient who had a COVID. You're separating him. You're keeping him in an isolated room. But why has he ended up there? Because of all the nutritional problems. We talk about day in, day out about maternal mortality. We may improve our transport system. We may make sure that she reaches the hospital, provide 101 things, provide a doctor. But what is the cost? The nutrition, which we are not addressing. We're not thinking. We're not trying to improve the healthcare system. We as a citizen have some basic need and then responsibility to make sure we have a healthy India. So if we start using this Ayush system of every doctor trying to put in their specialities, people can really address the real emergencies and use more time in bringing a better healthcare to the people, make sure that the media are only coming to the hospital when we are sitting at home. So how are we using it? We will be discussing in the next session of what all can be done to go ahead on the third session.
Great. Thank you so much, Dr. Lavanya Kiran. And handing it over to Kalyan to share the story behind the insights that you shared with us.
Thanks, Chief. Just to quickly recap, I said two things. The first thing I said was that telediagnosis is the future of telehealth. And the second thing that I said was that the real impact of telehealth will be seen in a large way in tier 2 and tier 3 India. My experience comes from just being a patient. When I've gone and done a physical examination and got a physical examination done and an auscultation done when I was a kid, it was not socially distanced auscultation. Right? There was a doctor who was feeling my pulse, who was putting a light, and looking at my pupils, who was looking at my tongue. The whole point was that doctors need data, objective data, to make better decisions. And seeing somebody on a video is not going to make your day better. You may feel a little confident for the next 10, 15 minutes, but nothing is going to change after that. And when I say that telediagnosis is important, what I want to say is that any objective data that doctors have that helps them get a better understanding of the patient's situation is going to help. And that doesn't mean that it only has to be radiology or pathology or microbiology. Even today, having much better cameras helps doctors really, look at a patient's skin better and understand their current physical situation. Devices like SpO2, BP, stuff that are now available in every home are going to help doctors make much, much better decisions. But I think entrepreneurs and policymakers should understand that, promoting telehealth as just a consultation as a Zoom call between a doctor and a patient is not the right way to go. And there has to be concrete data that can help these doctors really make better decisions. Another part that I realized was that when I worked with the government of Karnataka as a volunteer way back in 2015, the government of Karnataka actually runs a telemedicine program. And 78% of all teleconsultations ended with go see your nearest doctor because there was no diagnosis associated. And therefore, I believe that, unless this is done, telehealth is going to remain a promise. When I say that I'm going to give you an example of how now digital health is already felt in tier 2, tier 3. So I run a company that is into radiology. And what I do is I help hospitals and diagnostic centers get fast reports through my platform, through fast radiology reports. What I've seen is that through my platform, a lot of tier 2 and tier 3 centers have stopped printing radiology film because of 5C. And we have given them a system where they can automatically share all the key images with their referring physician and with the patient through a simple and secure link. While a lot of diagnostic centers in Bangalore still want to print film and give it to the patient and give it to the physician, tier 2 and tier 3 diagnostic centers are saying, hey, this is a cost, and I want to avoid it. And I believe digital is going to already give me a much better experience and give the patient and give the doctor a much, much better experience, right? So these are the 2 points that I wanted to kind of bring out from my personal experience. There are a lot more, but since we are at 3 minutes, I wanted to keep it short and sweet. Hope I was able to give a clear understanding of why I believe that these 2 things are going to happen in the future.
Okay, thank you so much, all the panel members. That was our segment 2. We move now towards the segment 3. That out of these insights and the stories that you've shared behind these insights, what are the new ideas that are on the cusp, the trends that we see in the industry coming up? And we will discuss that with each of our panel members. And to start that, we'll request Aryaman you to change the slide and move to Dr. Ramesh sharing his ideas on the cusp.
Yeah, normally it is the entrepreneurs who come to us with ideas, but if you ask me to point out what those are in biology and on the tech side, in biology, I think I strongly feel in the next 5 years, 10 years, some innovative company can come up in vaccines. not the COVID vaccine. There are still opportunities for pneumococcal vaccines, influenza vaccines. There's still opportunity for a new startup to come in. I'm also a strong believer in cell therapy, gene therapy, for example. There are so many neglected diseases out there. I won't be surprised if a good startup comes up in that space. Genomics, personalized medicine, while I'm a strong believer, it will take some time. Even though the cost of whole genome sequencing has come down to $1,000 or $500 maybe 6 months back, my guess is it will come below $100 in the next 3-4 years. And Illumina is working on that. And a couple of UK companies and Korean companies are working on that. So probably 5 years down the line, probably a genomics, there'll be an opportunity, but as on today, it could be a tough space. Even though certain youngsters are working on using genomics for antimicrobial testing, so bacteria. Oh, that's too much. I think they're fine. I don't know whether this is 2 minutes. So those are the 2-3 opportunities in biology. And on the tech side, I think it's real wide open. I think telehealth, digital health, digital therapeutics. I think once the government opens up, Lavanya also made some comments. I think the entire way we practice medicine will change. And I think a dime a dozen ideas are there which can happen in telehealth.
Great. We move on to our next panel member to share his viewpoints. Dr. Ravi, over to you.
Yeah, thank you very much. I'll say 3 things though, and I'm basically assuming that most of the audience, I see about 100 people here, are either aspiring entrepreneurs or already entrepreneurs, and young entrepreneurs. So I'll say 3 things. One is that definitely at this point of time, considering the time, effort, money required and support facilities available, I think the focus on low risk devices, class 1 devices, which is screening, monitoring, preventive, you can say diagnosis and early treatment would be better, because prevention is better than cure any day. And I agree with all the other panelists, even in this context. The second point I want to highlight is that in line with what I already told you earlier, the biggest problem actually happens in translating what is called as a lab prototype into a commercially viable or market ready product. Okay, and there are many things that go into that: expertise, facilities, materials, manufacturing, all those things. And neither academics nor the industry, regular industry, have that expertise. So it's a very, very big problem that we have to solve in the country. The third thing which I realized from talking to a lot of entrepreneurs, both within and outside our ecosystem, is that they all need mentorship. And I keep saying that mentorship is not meeting once in 3 months and saying, how are you doing? But mentorship actually is a 3 a.m. kind of a thing, that and entrepreneurship is a very hard game. You're running very hard. And at 3 a.m., if you get a doubt and then you want to get an answer for that, can make a phone call and get the answer to that from your mentor. So this mentorship is not available in engineering institutions or anywhere else, R&D institutes in the country. So we need to worry about developing that, even identifying, training, supporting, nurturing mentors themselves, so the next generation of entrepreneurs can come into the job much more efficiently, obviously, and create success stories.
Yeah, thank you so much, Dr. Ravi, for that input. Ideas from the cusp from Dr. Lavanya Kiran.
So before my music comes up, I would go, oh. I know telemedicine, teleconsultation is the way forward. AI is the way forward. So let's use this AI and help all the clinicians out there like me to make their life more easier. We know there are a lot of gadgets. Now we have to think about how utilizing AI and connecting all the existing modality into one. We know EMR is one way forward and is going to be the in thing, whether the doctors like it or not. Make sure this AI is inculcated into your EMR when you talk to a patient, because doctors wants to be talking to a patient, and that's what the patient wants in return. Not that we're sitting like a typist and typing all their complaints. Think about speech to text, where it comes in. While I'm writing a prescription, it makes my life easier. Where I'm doing a telemedicine and then I do talk to the patients, it automatically comes, what are the side effects of every medicine that I'm writing. Make sure that AI is used to pick up there's no overlap of medications, the side effects of medicines are mentioned. AI need to be used to mass screening that needs to be used as detectors, where you detect the disease even before that person gets to know that they have a disease. They're going to the malls, they're using escalators, they're traveling, use sensors so that you can pick up the alignments, so that you can trace them and tell them to go to the market. That's the way forward. I feel mass screening is very important, and we'll see how to take that forward.
Great. Thank you so much, Dr. Lavanya Kiran. Moving to the entrepreneur's perspective, Kalyan, ideas from the cusp.
Thanks, Chief. I'm going to stick this time to the fact that I believe that the big growth for telehealth and telediagnostics and the opportunity in health tech is going to be in tier 2, tier 3 cities for multiple reasons. I think it starts with the fact that fundamentally most of our country lives there, and we are coming to a point where even citizens are demanding that if you're living in Tirunelveli in the deep south of Tamil Nadu, you do not want to travel to Madurai, to Meenakshi Mission to actually go and get quality healthcare, right? You expect it. You expect high quality healthcare, high quality diagnostics, high quality treatment wherever you are. I think there's an opportunity to build new solutions and make it available to new establishments in healthcare who do not have the same inherent cost structures as a large hospital or a large diagnostic center in a metro city. Along with the fact that, I think the core problem that entrepreneurs talk in healthcare is the fact that there are so many established incentives and so many existing cost structures that do not allow new technologies and do not allow new innovations to come through. In a new setup, people are looking for cost cutting. People are looking for ways to make their practice faster, better for patients, give a better experience, win in a competitive market. And good solutions should be work with players like NH, but should be, I believe, will win, not in a massive tier 1 hospital, but in the smaller hospitals across the country.
Great. So that was our segment 3, and all 4 of our panelists shared the ideas that arrived from the cusp, from all the insights in these stories that they've shared. And now we move on to our final segment, which is acknowledgement by domain, which is what is it that the investor feels on the viewpoints of the incubator, the clinician, and the entrepreneur, and so on and so forth, where we keep changing those roles. And that is where we first move to Dr. Ramesh, your perspective on acknowledging the points of all the other 3 panel members.
I will comment on one comment made by Ravi. From a prototype to a prototype ready for manufacturing. I think many people underestimate. Recently, I was talking to a founder who has a fabulous product, very high-end medical product. I was talking to someone from the industry, and I'm surprised actually. He says, Dr. Ramesh, only 5% of the working prototypes, very good working prototypes, really make it to the market. I think that was a real learning for me, and Ravi's comment re-emphasized that. Initially, I thought if I have a good product which has been able to demonstrate, I thought reaching the market is easy. I think there are many pitfalls from that stage to commercialization. I think that's a real, probably a lot of innovators come in medical devices, they show a functioning prototype, it doesn't, at the end of the day, it won't make the icing. And second, I think coming to Kalyan, I think this whole gamut of teleconsultations, telediagnostics, tele-ICCUs, I think why should a pathologist go to a hospital? Why should a radiologist go to a hospital? Why should a dermatologist go to a hospital? I know Dr. Lavanya will strongly object to that. But definitely to a reasonable extent, certain clinicians can work from home and at the same time provide, and not just tele solutions. I think as the tele solutions improve, the AI solutions will be brought on top of it. And I think it will only make clinicians better and better. Many times when we say AI solution, whether it's tele-radiology, tele-pathology, or tele-dermatology, we try to compare with the best radiologists, pathologists, and dermatologists and try to prove AI is equal to them. But if you see an average pathologist, average dermatologist, if it can be better than them, it's only helping the human mankind. And coming to Lavanya, I think many devices are there out, many IoT devices are there. How to integrate them into the daily workflow. And I think I like that message that like the way you get a bank account every day, so many nonsensical things comes to you, but why not your own parameters? How did you do yesterday? How did you do last 1 month? The question, some of these ideas are good. I think the monetization issue will come in. That's where the bright entrepreneurs have to crack it. These are my 3 comments on 3 great panelists today.
Absolutely apt acknowledgement from the investor's perspective. Moving to Dr. Ravi, bringing in an incubator and innovator's perspective.
Yeah, I actually liked many points, and I also referred already in my previous segment. Let me isolate a couple of points. I'm also seeing from an Indian point of view, Indian entrepreneur's point of view, what can perhaps be low-hanging fruits to be successful, okay? So I would say, what is it that Indians can do which others cannot do? Let's say foreign MNCs cannot do, Western MNCs. So one definitely is that if you bring in the Indian medicine, which is Ayush and nutrition and our foods and things like that, I still feel that why should we go to McDonald's and why not go to a dosa or idli kind of a thing? I mean, our food, our breakfast is far more healthier. So that those aspects, which also ties in with the preventive and things like that, that is one part which Dr. Lavanya said, and I really agree with that. The other thing which Dr. Ramesh said, and also I think Kalyan to some extent, the role of doctors in defining and also giving the feedback on developing the products. And of course, I'm so great that Dr. Ramesh is also an investor, so he's the best of both worlds. So I think the role of doctors cannot be underemphasized in the development of medical devices. They have to be part of the journey right from beginning to the end. You can't consult them again once in a while. It doesn't work that way. And the last part is that this, when it's a telemedicine, the point I agree, but I want to emphasize that, we have 5 senses, and doctors also need to, they don't judge a patient just by looking at the patient. What about the sense of touch? What is smell? Of course, you are hearing maybe and seeing, but not touching. So that some technologies, I think somewhere you mentioned Dr. Lavanya is doing robotic surgery, I think. But
Yes.
can you think about, let's say, remote robotic surgery with a sense of touch? So you can actually feel a tissue's hardness, let us say, or it is slippery or not. So I think people are working on those technologies, and we will see those maybe in our lifetime. So I want to just, if you give me 1 more minute, I would like to say that I think this is a very exciting time for entrepreneurs in this field, because one is that I asked you for 1 minute more.
Please continue. Please continue, Dr. Ravi.
We are teachers. We have a counter in our head, okay? So I think that it's a very exciting time for all the entrepreneurs, because one, of course, healthcare has now become center of focus once again, which is how it should be. India classically ignored education and health, and I think both are now coming center stage. That's great thing. Number 2 is all these technologies, which I don't want to even list, apart from AI, robotics, blockchain, medical imaging, processing, even 3D printing, CAD/CAM, all those things put together. And IT is kind of center of all those things where Indians are supposed to be good. It's in our blood maybe. So I think we can leverage these things to come up with a new generation of medical devices. And the third thing I would say is that government and industry CSR and society in general, even parents are telling their kids, okay, you want to do something useful, interesting, 1 year of entrepreneurship, that support is coming up. So I would say this is a fantastic time to enter entrepreneurship in general and healthcare entrepreneurship in particular. If you succeed, great, you're making impact. If you fail, you still come up with so much of experience that no matter what you do, the next job, you'll still be very valuable to your employer. So I would close with those statements. Thank you.
Okay, thank you, Dr. Ravi. And moving to Dr. Lavanya Kiran.
Thank you for all the points noted, whichever I've put it down. You mentioned about robotic surgery. Yes, I am a robotic surgeon. I call myself sometimes a fancy surgeon, because moving from laparotomies, laparoscopies, keyhole surgeries, I'm sure with all you people, wonderful innovators and the entrepreneurs sitting there, it is going to be no short of pinhole surgeries in the future. So that is the way forward to look because of such wonderful platforms. And I only request, like Dr. Ramesh mentioned, to integrate the existing AI into one and another so that it's useful to the end users and the healthcare users like Dr. Kalyan mentioned that, telemedicine and teleconsultation is the way forward. I'm telling the innovators like Dr. Ravi and the others out there that let's look at home monitoring system. Like I said, the pregnant woman doesn't want to come into the hospital. Why are we not thinking about a device that we can give it to her and she can record the FHS? That is all. Sometimes, most of the times, the emergency people who are coming into the hospital is just a panic mode. Once they're reassured, we are cutting down the number of visits that is required. So hence we're cutting down the number of resources and the personnel used there. So think about such innovations which can be easing out the patients at home care can be stabilized. And coming to innovators, I have only one request: whatever you come up with, make sure any innovation you do is scalable. It should be sustainable, accessible, and most important, affordable. And innovation comes to Indians. It is in the gene. It is in our DNA. Don't get worried about it, because Indians are very awesome in jugards, and it's in our gene. And I'm sure before I conclude, I hope I bring a smile. We don't have to talk about the extensive use about the bunions and the toothbrushes, which go a long way. Nobody else other than Indians can think about it. So all you people, elite crowd who've logged in today, are wonderful innovators, entrepreneurs. So let's all sit together and make sure the healthcare workers, I'll just take just 30 seconds, how we can inculcate all the AI together. So when a patient's sitting, like I said, writing down just a prescription, listening to a patient is stressful for a doctor. Imagine if you save their time with good prescription, drug interactions, the side effects which comes automatically with the patient. You're saving so much time for them. This time saved, the doctor can use to relieve stress for them, because if you're losing out a single doctor out of stress or any comorbidities they are acquiring by looking after the population, remember it takes 10 years to make a single specialist. So try and make sure that you ease out the healthcare workers' stress, workload, and also come up with good innovations and entrepreneurship. Wishing you all a great luck.
Thank you so much, Dr. Lavanya Kiran. And moving towards the entrepreneur's perspective, acknowledging the domain. Over to you, Kalyan.
Dr. Ramesh, had started by saying that it has that this whole pandemic has put a lot of focus on Indian innovation, and kind of combining what Dr. Ramesh said and what Dr. Ravi said. I think one of the interesting things that I have seen is that one example is that India actually went from an importer to an exporter of PPEs in a matter of less than a month. And so we were able to change our supply chain. We were able to make sure that we had enough for not only internal use but also going external. I think that definitely shows the fact that we are fluid and we are nimble in terms of our innovation. Dr. Ramesh also said that now biology is a focus, and I think that we're kind of moving from service to product. Today's India is still very much a manufacturer of a lot of pharma, a user of a lot of external innovation, but that is changing. I think Sir also gave a lot of fantastic examples about that. One important point that Dr. Ravi Sir had raised was that prevention is obviously much better than cure, but unfortunately as an entrepreneur, prevention doesn't pay as much as cure, and that is an unfortunate fact. And there are potentially ways to get around this. You need to include insurance. There has to be business model innovation as well. But I'm confident that with the whole thing going digital, that can come in. And finally, Dr. Lavanya, I'm a fan of your work. I mean, your stories about using Da Vinci, in your space are well known across, in Bangalore at least. And the fact that somebody who's so accomplished with such a niche and important technique is telling us, hey, don't get to that. Eat your vegetables, eat your fruits, eat healthy, sleep well. Practice good health, and that's the best way to to be healthy. So I think your point well noted for me as well, Doctor. And had a fantastic time listening to everyone. And anybody has any questions, very happy to take them. Thank you.
Super. Thank you so much, all the panel members, for this lovely conversation. And we move to the next one, which is we open up the floor for few questions. We've got a little time, nearly time up, but yeah, we could take about 1 or 2 questions. We have one question here, which is please share your views about cyber security in digital health tech with respect to medical data. Dr. Ramesh, would you like to take this one?
Obviously, I am not a cyber security expert, but definitely every data has to be protected. I'm sure every country has their own guidelines, like HIPAA guidelines in USA or GDPR guidelines in Europe, and even India has their own guidelines. In fact, one of our portfolio companies called Shield Square is into cyber security, has been acquired by a European company. But definitely, there's a big opportunity as the telehealth picks up in this country. There's an opportunity for people who are providing cybersecurity solutions for healthcare. That can be a big opportunity in the years going forwards.
Great. And there's one more question that will have Dr. Ravi, you take this up. So Sumit Singh has written, working in the social healthcare sector where the purchasing power parity for availing even essential services for the end user is not the greatest, even though Ayushman Bharat provides insurance, but the end user hardly knows about it. So the fear of availing services as it would come for a cost. And for an investor, they would like to see a return. So for a PPP model, how can the insurance sector help in creating this ecosystem where they support the innovators?
Again, I'm not an expert in that, but let me take a step back and say that the final cost of a product depends on many factors. And let me also say that when you look at imported products, and I don't want to be quoted too much on this, but sometimes some companies, they even have 90% plus profit margins on that. So obviously, when we talk about PPP model, and we can, and if you develop the product for, first of all, masses, number one, so that the profit margin is, so per product is less, but when you have a large number of populations, then your total turnover will still be same. That is one way of looking at it. Second thing is in medical devices, the largest cost going into what I call as your lab testing, clinical validation, and for those two, of course, you need also the first batch manufacturing, because when you go to industry, they will say that what is the batch size? If it's 100, the cost is the same as whether it is for, let us say, 5,000 or 10,000. So and the product is going to change after the initial test. So these costs, if they are covered partly by the government, partly by the innovators, entrepreneurs, industry CSR, and so on, then the cost per product can come down. Then the other aspect of actual distribution costs and using insurance model and things like that, which is a question of the information being propagated, systems being put into place. The digital obviously is going to help a lot, even in preventing fraud and things like that, or misuse of the funds. That is a matter of time only, because I think our country is now digitizing with a vengeance. I would say, I think we are digitizing much faster than the rest of the world. We are not only caught up in many ways, but we are even exceeding many other countries, because we are starting at the latest thing. Even HIPAA or digital security, which Dr. Ramesh mentioned, I think we are in a position to roll it out much faster because we are not entrenched in some kind of a previous digital system. We had no digital systems. So we now can actually jump into the next generation things, maybe wireless and security and next level of security and so on. So I think one line, if I summarize the whole thing, India is in a position not only to offer affordable healthcare for its own citizens, but I would even say that countries like Africa and maybe Southeast Asia will look up to India to offer these services. And that's why the world is big. If you get into this game and we get our act together, all of us, we panelists should not stop with this. Maybe we should have a separate chat without the pressure of the drums going back, separately. I know all of us are busy. I'm also, in a tough position, but I think good things are happening. And I can share with you a little later many things that are happening, and we should get into those which can steal some time to get into that. But entrepreneurs, please, I think take the opportunity. Once again, I'll say the same thing. Sorry for a long answer.
Great, thank you so much. Thank you all the panel members. I'm sure that there are more questions that we see, in the chat room. We'll be happy to take all of these questions offline. Some of you would want us to help you connect with the panel members. We'll be happy to do that as well. You could follow us on all our on the social media network for entrepreneurs here who are looking for funding. As some of you mentioned, you could reach out to us on our website. There's a process for you to apply for incubation and receive access to funding. We'd be happy to help you with those as well. For any unanswered question due to paucity of time, please feel free to write to us, and we'll be happy to connect you with the panel members and ensure that all your queries are addressed. We thank you all panel members for being supportive of this new innovative format where we said that let us structure our thoughts in an innovative way, and that's where we kick-started this conversation. We'll be conducting more such activities on our website. You'll also find a lot of blogs that will help entrepreneurs in terms of their journey. Look forward to keeping in touch with you. Also, feel free to later on access this video on our YouTube channel. Thank you, panel members. Thank you, all the participants, for joining us on this session. Thank you, everyone.